In our plan, the only fair, forward-looking, and fully costed plan that's being offered by any party or anybody running to be premier in this election campaign, we'll do two things. Number one, anybody who wants to pursue their university studies in healthcare, doctors, nurses, and others who is prepared to practice in underserved, remote, and rural communities, including in the north, won't have to pay any tuition. Secondly, we're actually going to increase the cap on seats or spaces at the Northern Ontario School of Medicine. We've also made a commitment to make sure that right across Ontario, including in the north, where we've heard about the challenges in this regard, that every single Ontarian can have access to a doctor or a nurse practitioner within 24 hours. Then, as part of our broader healthcare rebuilding plan in our public system, we're going to be, over 6 years, hiring up 100,000 new healthcare workers, nurses, doctors, and others. We know, for example, there are 15,000 internationally educated nurses at a minimum living here in Ontario who have the capacity and the desire to practice their profession. They're just being held back by an outdated, old-fashioned credential recognizing, if I can put it that way, system. We're going to clear that up and make sure that we get them out of the bleachers and into communities like Red Lake where we need that help.
And so we, for quite some time, have known that the folks in the north don't have equitable access to healthcare, including doctors and nurses. So we have a plan to hire 300 doctors and 100 of those being specialists to make sure, 40 of those actually being specialists, to make sure that that we cover off the need. We're going to make sure the Northern School of Medicine has more spaces available. But there's more to it than that. We have to make sure that northern communities are places where doctors want to bring their spouses and their families, and so making sure that those communities have the offerings that will attract people to set down roots there is also a big part of our commitment.